And do we have Loretta with us? Lavetta, I mean. No. Oh, yes, we do. We do here. There we go. And Laura. Hi, Lavetta. Hi, Laura. Good to see you.
Nice to see you, Todd. Hi, all.
It's been a while.
Too long.
I know.
Too long. But this whole year has been, I think, too long for everybody.
Yeah. There are so many people that I've met and like spent hours with, but I've never met them in person.
It's pretty weird.
It is pretty weird.
It's pretty weird. I wonder if when we all get to actually meet one another, whether we'll see one another completely differently.
Yeah, what are we going to say? Like, oh, I never knew you were so short, or I never knew you were so tall. Let's see here. All right, I guess we could get started, right? And we won't do theme music for this event, huh? We'll have a little, yeah, we'll have a little dignity, and we won't use our usual theme music when we let people in. Hello, everyone. Still letting some people in. Good. I see Ben Stalls coming and Bill Di Sabato. That's good.
And there's Aaron.
And there's Aaron. Hello, Aaron. It's good to see everybody. I know we're still letting some people into the waiting room, so we'll just take a minute and allow people to come in from the waiting room. We are streaming also on Facebook and on YouTube. And we will have some speakers, and then we'll have some Q&A and a few announcements, I think, at the end, when we're just still waiting to admit some people. And I am tap dancing. My name is Todd DiPastino. I am the director of the Veterans Breakfast Club, and I'm just here to moderate our fourth COVID-19 Veterans Virtual Town Hall to present information on the programs and resources and services that are available to veterans and their families during this time of COVID-19. We have 9 presenters and from various organizations and agencies, and we will have plenty of time for some questions at the end. The ground rules are that each presenter has about 10 minutes, and I'll be ruthless. I should have an air horn and just blast the air horn at 10 minutes, but each presenter is 10 minutes. And then we'll have some time for Q&A. Again, I see people still coming in from the waiting room. My name is Todd. I'm the executive director of the Veterans Breakfast Club, and we're a nonprofit here in Western Pennsylvania that holds veteran storytelling programs, and we've been doing it for 13 years. The past year has been all virtual. You could join our programs. Everybody is welcome to join our programs, and you can join our programs, check our schedule at veteransbreakfastclub.org. And I have to get that little plug in for the Veterans Breakfast Club. Please do join us. We'd love to have you, veteransbreakfastclub.org. But we're going to go with somebody who is ailing just a bit so that he could go off screen if need be. And that's Rob Hamilton, who is the executive director of Veterans Place on Washington Boulevard. And Rob just had his second COVID shot, so I think he's feeling not completely up to snuff. Rob, why don't you go first, just in case you have to bow out?
I appreciate it, Todd. Thank you. So first off, thanks for hosting this. And Dwight, as always, thanks for putting this together. Great job keeping our Southwestern veterans informed of what's going on in the community. Todd was right. I got my second COVID shot last night, and boy, did I feel it through the rest of the night last night and into this morning. Shannon was giving me a hard time from Veterans Place, making fun of me because I told her the vaccine can't hurt this guy. Little did I know the vaccine sure did. So I will start off by saying any veterans that are watching live on Facebook or YouTube or joining on and they haven't got their COVID vaccination, I know I definitely highly recommend it. 80 to 90% of our staff already have had their vaccinations, as well as a large portion of the population that we serve. And I hope for those that are considering it, they have a that they'll take advantage of the resources that are out there through the VA as well as other community partners. And so we all can get back to, I don't know if it's ever going to go back to normal, but some version of normal in the future. So I'll kind of go through the slides and just a little bit about Veterans Place for those of you who don't know. I served in the Army and I've been at Veterans Place since 2016. Now, I don't know, Todd, do I just say scroll down?
So you're sharing it and not Ellie? Oh, Ellie's, yeah, Ellie's doing it. So she'll, yeah, tell
All right,
Ellie what to
Ellie,
do.
I'll just say, how about I just say next, Ellie? How's that?
Sounds perfect.
All right, so Veterans Place mission and vision is on the screen, but I really want to focus kind of on this quote from one of our stakeholders. I speak with a lot of veterans and they say, they gave me this or they got me that. And when I speak to Veterans Place veterans, they say, they helped me achieve this and this is where I'm going, a sense of hopefulness about their future. So one of our primary goals at Veterans Place is, yes, we want to end veteran homelessness and get veterans back in the community, but we really want to help them achieve their version of success, whatever that means. However we can go about doing that and support them in the best ways possible. So during COVID, it has been very difficult, and Veterans Place remained open, remained serving veterans on site, and if virtual was the preference for the veteran, we did that as well. But we wanted to make sure throughout COVID and throughout everything that's been happening that the veterans' success was at the forefront of the organization. Next slide. So during COVID, we served about over 500 veterans, connected in 2020 over 110 veterans into employment, served over 5,000 meals, and we remained open during COVID. So we had a lot of things that we came through. The food bank was great. Veterans Place is a certified food pantry through the food bank. And so when they came up with the food share program and a contactless delivery that enabled us to serve more veterans through that, that was a great thing. As you'll see further on the slide, for any veteran out there going through food insecurity and needs food, we are open 24/7. We would ask that a veteran call ahead, and down at the bottom of the slide, you'll get our number. It's 412-363-0500, or you can visit us at www.veteransplaceusa.org to visit on how you could email us or show up on site, whatever is preferable to the veteran. But we will never turn the veteran away to get food or supplies. I know the other day that Dwight actually just brought somebody down who needed to get connected with some dog food. So we have dog food as well. We have dog food, cat food, human food, whatever food is needed. We have it available for any veteran that might be experiencing any type of food insecurity. Next slide. So through COVID, we were very happy to kind of say this on the town hall meeting. All of our programs were just recently went through a CARF accreditation. CARF is a commission on accreditation for rehabilitation facilities. So all of our programs are about another week left, and they'll all be CARF accredited. So that's through our community housing, our transitional housing programs, community employment, our HVRP, as well as community job development, and then our service coordination, which is through the service center and houses about 7 or 8 programs. And we'll go through what those programs are. Also just received the Platinum Seal of Transparency for GuideStar. We're happy to report for every dollar that goes to Veterans Place, 92 cents goes straight to the veteran programs. And we want to make sure when somebody donates to the organization, especially in times like COVID, that money is going straight to the veteran to be able to help them to the best of our ability as an organization. Next slide, please. So during COVID, again, we had a 24/7 food bank access, assistance with transportation. We're actually currently doing a fundraiser now to purchase a bus for veterans use, because the request for transportation has probably doubled since COVID, if not tripled. And so we want to be able to meet the needs of those veterans, especially providing handicapped accessible transportation as well. So you can currently find that on our Facebook or our website, share with your friends, however you feel comfortable supporting. But our goal is to be able to provide any type of transportation that a veteran may require during these times. We have virtual support groups, and as kind of the restrictions open up, we will be opening those support groups up in person, following CDC guidance and what we can. And in summer 2021, sometime in June, we'll be hosting on-site stand down, where we will again assure that we are following CDC community guidelines, but still offering that support to veterans who may need to get connected with those services for stand down. Next slide, please. So our Veteran Service Center remains open. There's a list of our programs for pretty much if somebody needs help, we'll be able to assist them. They can call this number, which is a direct line to the service center instead of calling our main one. It's 412-320-5566. They can stop by at 945 Washington Boulevard. And Pittsburgh does have an H, but we'll just leave it that G there at the end for myself, who misspelled that in putting this. So Service Center is one of 15 in the nation, funded by the VA. It's a resource center where veterans can come in that are homeless or at risk of homelessness and receive multiple services. We have on-site food bank, we have shower facilities, free laundry facilities, a computer lab. We have a smart classroom where we do trainings in groups, and a commercial kitchen where they can stop and get breakfast and lunch. And all those services will be on the next slide. We have our female veteran program, low-income veterans and family, opioid response, and our GPD case management. And Todd, you just let me know if I'm approaching that 10, but I think I'll be able to get it. The next slide lays kind of out the services that I just discussed for any veteran in the community. And the next slide is our transitional housing program. We remain open, still taking intakes. One change with COVID is that we do require participants to get a COVID test. We don't require any veteran to have a vaccination, but we do have to test veterans coming in for the safety and security for the other veterans living on site in our 13 townhouses and 48 apartments. Next slide, please. So anybody outside of the VA, any veteran that's already in VA care, looking to get into the transitional housing programs that are listed there, they can just go through their VA social worker and ask to go to Veterans Place, in which a referral can be sent over to Veterans Place. And any non-VA referrals, these are individuals who are not currently being served by the VA, community partners, drug and alcohol rehabs, whoever. They can go straight to the VRC, in which that number was listed above. Next slide, please. We remain serving veterans in employment with all of our employment partners. We have about over 450 employment partners that we work with through the pandemic. Out of the HVRP programs, we continue to serve our veterans along with other partners. And we were able to, again, place over 100 veterans in 2020 fiscal year. And so far into this year, we already served about 80 veterans since July 1 of 2020. So we continue to place veterans. We continue to work with employers, and we assure that we're matching the right veteran with the right job and making sure that it's a perfect fit for that veteran. And again, the most important part is their version of success. We want to assure that they get that. So next slide, please. And these are some of the services that the HVRP offers: supportive services, employment training, financial support, job-related, resume building, job coaching. And obviously the kind of biggest thing is the job search and case management. And my last slide, and I hope I'm in with the time, is if anybody is trying to connect into Veterans Place and they have any questions at all, you can simply just email info@veteransplaceusa.org. You can give us a phone call at 412-363-0500, or you can visit us on our website at veteransplaceusa.org. And our website has all of our program information, everything that frequently asked questions, whatever somebody may need. Or if you just want somewhere to come by and get some coffee and have some conversation, we're available as well. And that's pretty much all I have, Todd.
Excellent, Rob. And you had about 5 or 6 seconds to spare. Well done, especially considering that you have a fever delirium. That's very well done. Thank you, Rob, very much for sharing that wonderful information on Veterans Place. I want to go next to our acting director of VA Healthcare, Lavetta Ford. Thank you very much, Lavetta, for joining us this afternoon here.
Hi, good afternoon. Thank you for allowing me to join you. So I think someone from my site is controlling the slides. So I'm just going to
Let me try that one more time. Sorry about that.
Yeah, so do you want we could handle the slides for you, Lavetta, if you'd like.
Okay, so you have the slides?
We do have the slides.
Okay.
Can you see that?
I can see them. So I just want to, again, thank you all for allowing me to come and present for you. I'm no Mr. Koenig, but Mr. Koenig is on a much needed and very well-deserved vacation. So he does send you his regards. So I'm going to actually, I have a lot of data to pretty much share with you. So I'm going to actually jump right into it. I have been assured that this is within the 10 minutes. So let's, I don't want to say let's rock and roll, but let's go ahead and get started. So, okay, so we did begin administering the COVID-19 vaccines during the week of December the 14th. We primarily used the Pfizer vaccine, which requires 2 doses, and they're given 21 days apart at the same location. We did receive a small amount of a Moderna vaccine, which we used during, oh, is that me? Or yeah, that's me. We received a small amount of the Moderna that we used during the off-site COVID-19 vaccines in the clinics in Washington, Fayette, and Beaver counties. We do not anticipate receiving more of this type of vaccine. We also received a small amount of Johnson & Johnson 1-dose Janssen vaccine. We do not know when we may receive more of this vaccine. Since we have such a limited supply of this vaccine, we are reserving it for very specific circumstances. And then as of March 19th, we have eliminated the age criteria to receive the vaccine. Veterans must still be eligible and registered for VHA care and not have had any vaccines within the past 14 days. We are now offering the COVID vaccine by appointment at our 2 medical campuses in Pittsburgh and our 5 outpatient clinics. The outpatient clinics have a very limited capacity each day. Due to our current higher than normal call volume, we do encourage the veterans to send a secure message via their My Healthy Vet to their primary care provider to schedule an appointment at our University Drive campus, our H.J. Hines campus, or an outpatient clinic. We are also accepting walk-ins at our University Drive campus only from 7 to 5:30 p.m., Monday through Saturday, except federal holidays. We do not offer walk-in inoculations at our H.J. Hines facility or our outpatient clinics. In addition, our home-based primary care teams have been vaccinating veterans in this program in their homes and have expanded to offer in-home COVID-19 vaccination to veterans that are homebound or have transportation barriers and live within 25 miles of the university campus. Next slide. On March the 19th, we administered 40,000 COVID-19 vaccines. We fully vaccinated more than 14,000 veterans and more than 3,000 employees. Approximately 4,000 veterans and employees have already received their first dose of vaccine. We are now posting COVID vaccine data on the COVID-19 National Summary Tool. And you see that link is there as well. On March the 14th, next slide, sorry. On March the 14th, President Biden signed the Save Lives Act into law. Now all veterans, all the caregivers, and all spouses are eligible to receive this vaccine. We are also accepting walk-ins for, again, at Monday through Saturday at the University Drive campus only. And those are, sorry, again, from 7 to 5 p.m.
Yeah, I see it.
You talking to me? Oh, I'm sorry. Someone said they saw something. I didn't know what. Please visit our VA Pittsburgh vaccine webpage. Excuse me, for all updated or local information. I'm going to share with you now our latest data. Next slide, please. These are the websites that I just was talking to you about that you can sign in or go to the website to see the latest data. Next slide, please. Okay, so these are our current numbers, and these are current as of 4/9 as of this morning. Right now, we do have 5 inpatients that are COVID positive. We have 38, and this has been a recent increase with, I would say, probably the weather and outside gatherings and groups. So that's increased. We have 38 outpatients. We do have a currently following 11 employees. And unfortunately, we've lost 86 of our veterans to COVID-related illness. Next slide, please. So we do still have some restrictions in place, but we don't want you to delay your health care because of the virus. We're scheduling surgeries, even elective surgeries, and other procedures as normal. We have numerous safety and infection prevention strategies in place to keep everyone as safe as possible while you're at our hospital facility. We've eliminated the valet service from our University Drive parking garage. As of last September, we've actually asked some of our staff to park on an off-site parking lot, and we are giving them shuttle service to the University Drive parking lot. The additional parking that this has made is going to allow for more patients to come in and us to have more in-person appointments at the University Drive campus. Virtual services have been a valuable link between our veterans and our providers during this challenging time, and we continue to increase those. In 2020, we saw a 42% increase from 2019 in the number of telehealth visits that we were provided. Most people seem to like telehealth. I personally like it. Some of our veterans, it took them a while to get accustomed to it, but now they seem to like it as much as I guess as much as I do. So we've updated our inpatient visitation policy, and now we do allow one support person to accompany the veterans to appointments and outpatient procedures. Inpatient visitation varies throughout the facility, but we do have more about that on our Facebook page. It just depends a lot on what unit the veteran is on, but ultimately we want everyone to be safe. We don't have any complacency. Even if you receive the vaccine, face masks, careful hand hygiene, physical distancing, and other precautions are still critically important and are required for everyone in the VA facilities until new infections drop to extremely low levels. We're now posting weekly reports on our national COVID-19 pandemic response. And here it is right here for you to see. Thanks. Next slide. Okay, next slide. I got to get this next slide part down. Listening sessions on the future VA healthcare. The VA Pittsburgh recently participated in the virtual listening sessions to seek the public's ideas on how the VA design a healthcare system of the future and grow services for veterans in a way that reinforces VA's role as a leader in the U.S. healthcare system. These listening sessions are being hosted nationally and are an exciting opportunity for veterans and the public to help VA reimagine how it delivers care in an equitable, high-quality, veteran-centered manner and develop a plan for investing in VA's aging infrastructure. If you're not able to attend but want to provide feedback, you can email us, and there's the email on link online, or check out the schedule to participate in an upcoming session being hosted by another VA network. And that's online. That's on the screen as well. Okay, next slide. For those of you who may not already be enrolled in the VA, I would also like to offer you the opportunity to join us and let us serve you. The instructions to enroll are on this website right here, and then there's also a number on here. And then there's also a link on here where you can get your 1010 EZ. So next slide. We'll host a town hall for veterans and the public on June the 21st at 10 a.m. We don't know if it's going to be a virtual town hall yet or WebEx or in-person event. We'll post more information on our Facebook page as we get closer to the date. So stay tuned for that. Next slide.
Thank you, Lavetta. You stuck it at 10 minutes on the dot. Thank you very much for that presentation. And that's Lavetta Ford, Acting Director of VA Pittsburgh Healthcare. Thank you for joining us. And next up is Elizabeth Lucas, who is with the Veterans Benefits Administration, Pittsburgh Regional Office. Elizabeth, you are with us, correct?
Yes, I am. How are you?
Thank you. Good, good. Thank you for joining us very much.
Okay. And yes, I can see the slides, so I'll go ahead and get started. Welcome and thank you for the opportunity. I am covering today for our Regional Office Director, Jennifer Vandermolen, who is out today. I am the Veteran Readiness and Employment Officer, the Division Chief of the Veteran Readiness and Employment Program, formerly known as the Vocational Rehabilitation and Employment Program, or Chapter 31. So my slide deck does have some information about that, so I'll briefly discuss that because that is a lesser known benefit, part of the Veterans Benefits Administration, but definitely very noteworthy of mention too. So our Pittsburgh Regional Office is open for limited operations. We are maintaining the COVID restrictions. We are available. Our public contact unit is open from 8 a.m. to 3 p.m. Appointments are preferred just because we have to maintain social distancing guidelines with our appointments. We do see walk-ins, so no veteran or a family member will be turned away. I just want to mention that. But appointments are preferred because we do have limited space just to maintain with the social distancing. And the information is to schedule a virtual or in-person appointment. We do have a log that where we schedule those in-person appointments with the public contact outreach specialist. And those individuals will be there to assist you with any disability compensation related questions, VA pension, any other benefits related questions that you may have. And that is the information. We do have a corporate mailbox, and the telephone number goes to a direct dial to one of the public contact outreach specialists. Next slide. VA has resumed the in-person compensation exams. The VA contract medical provider will contact you for your exams. Please note that no claim will be denied if you cannot attend due to COVID concerns. Until an in-person exam can be safely completed, you will need to notify the scheduler that you cannot attend an appointment due to COVID-related concerns, just to make sure that that's properly annotated. Next slide. The Veteran Readiness and Employment Program, which is my business line, we are scheduling in-person appointments. We have not, since the COVID pandemic, we have had full operations with veterans that participate in our program via telecounseling through the VA Video Connect system or Cisco WebEx, because the Pittsburgh Regional Office does serve veterans that are overseas, particularly in our program, the veterans in Europe, Africa, and the Middle East, including the Pittsburgh area jurisdiction and the 4 northern panhandle counties of West Virginia. So this is a system where we are able to serve our veterans in a virtual environment and be able to assume all operations to effectively serve our veterans with the mission of our program. There are also virtual appointments, even though that our office is open for limited operations. A veteran can request a virtual appointment with the public contact team. So I did want to mention that if I didn't mention that previously. With regard to appeals, the appeals are being scheduled at the veteran's request at the regional office. So if a veteran requests an in-person appointment for or hearing for their appeals, they can request that, and that request may be honored at the regional office. With respect to any debts, debt relief is extended through September 30th by the VA, and the VA will continue suspension on all veteran benefit overpayments and medical copay debts that were incurred after 1 April of 2020. Next slide. I did mention this earlier. VRE, or formerly known as the Vocational Rehabilitation and Employment Program, is now called the Veteran Readiness and Employment Program. And just a quick note, the mission of our program, we are a program that is for veterans that have a service-connected disability. The minimum service-connected disability is 10%. And our mission is we assist veterans with service-connected disabilities with preparing for, obtaining, or maintaining suitable employment or a suitable career. For veterans that participate in our program, we cover 100% of their training if additional education is training, and that includes any tuition fees, books, supplies, and they do receive a monthly stipend while participating in our program. It is one of the very few Veterans Benefits Administration program where the veteran meets personally with their vocational rehabilitation counselor throughout the course of their participation. The other track or mission of our program involves veterans where employment is not feasible due to the severity of their service-connected conditions. We actually adapt their home so they can remain at home, and that can include ingress, egress, walkways, accessible bedroom and bathroom, driveways, so that they can remain at home and be with their families if they choose to do so. So that is another mission or track of our program that we assist veterans in our area. And that independent living track is only available to veterans that reside within the United States. It is not available to veterans that reside overseas. Next slide, please. I did want to just briefly give an overview of the benefits of service connection. Just so that you have that brief overview, and there is a link there for the Veterans VA Benefit Eligibility Matrix. So for a non-compensable 0% disability rating, there's no cost health care and prescription drugs for service-connected disabilities. There are income limits that apply, travel allowance, and use of commissaries and exchanges. 20% VRE, I did mention 10%, but 20% we don't have to look at additional criteria. So I did want to mention that. For 30% or more, veterans do qualify for additional compensation for eligible dependents on their disability compensation. And then for 50%, a veteran can receive their concurrent receipt of their military pay and military retired pay and their service-connected disability. And 60% or more, that is the criteria minimally for eligibility to apply for individualized unemployability with the VA. Next slide. This is some recent information that I wanted to mention. We did get some communications through our business line with regard to pension poaching. It is a financial scam that is targeting veterans and their survivors and family members regarding potential VA benefits. I believe that Dwight had mentioned this earlier on in our conversation. It's very important to only use accredited VSOs, agents, and attorneys. You should pay nothing to submit a claim to the VA. The VA can help you file, and also are very important stakeholders being our veteran service organizations who have extensive training and qualifications to be able to assist veterans and their family members with benefits. So just wanted to mention that something that came recently through our communications, and have been distributing that to our staff because of the concern with regard to pension poaching. Next slide. I did want to mention this briefly. April is Sexual Assault Awareness Month, and the VA, I did want to provide some links because we do have public contact outreach specialists and veteran service representatives there to assist, that have additional specialized training to assist veterans with regard to applying for the claims too as well. So I did list their contact information listed there for your reference. Next slide. Did want to mention the Veterans Banking Program, about enrollment information and to manage your VA benefits and financial services through any participating, the participating banks that are listed there. It does have the contact information for you to have any questions or any inquiries. Next slide. I did want to provide the link for the VA Welcome Kit. It provides a wealth of information, very user-friendly with regard to the extent and benefits of the services that you yourself or family members have earned. And then the Survivor and Burial Benefits Kit, it does have excellent resources. On a personal note, I do encourage you to utilize calling the call center too. They were very, very helpful as a dependent of a veteran calling in that regard. They do provide extensive information, the amount of training that the toll-free call center number can provide to you if you're not able to schedule an appointment in with the public contact outreach specialist that we have here at the regional office. So I did want to make that note regarding the complex and excellent care that receiving from the call center too as well. And that concludes the sides from the VBA side of the house.
Thank you, Elizabeth. Another on the mark, 10 minutes. Thank you very much. And we're going now to Chip Gilliland. Chip is with the Pennsylvania Department of Military and Veterans Affairs. And Chip, you are the Chief of the Division of Reintegration and Outreach, correct?
That's correct.
All right. Thank you for joining us.
Thanks for having me. Good afternoon, everybody. Just wanted to give you a quick overview of what the department's currently facing here during the COVID pandemic. All of our programs and services are running as normal. We continue to provide benefits and services to veterans and their families through our programs here, such as amputee and paralyzed pension, the Veterans Temporary Assistance, which we continually help with veterans and their families through this program. We've seen an increase during COVID, as you can imagine, but our staff is keeping up with the demand, and we're rolling right along with that. Our office has been kind of closed, kind of open. We're totally open. However, some of our people are working remotely with a few days in the office during the week. And there are a few of us here that, come in every day and do the boots on ground kind of thing. A couple of updates through our Veterans Trust Fund. We went through the grant cycle that closed here about a month ago. The recommendations have been provided to the Adjutant General of Pennsylvania, and we're waiting on final recommendations for his approval. And as I mentioned, the Veterans Trust Fund, the VTA program associated with that is rolling right along, and no hiccups with that. The other outreach initiative that we have going on, as you can imagine, that with COVID, our normal outreach approach has been severely impacted. We canceled a lot of events last year that we normally do in person. We've done a few virtually, but as I say, outreach has, significantly been impacted by COVID. But through an initiative that we have come online on November 9th, it's called PA Vet Connect. PA Vet Connect is a new outreach initiative that we have. And what we've basically done is taken the Commonwealth divided it into 5 sections, Northwest, Southwest, the center part of the state, Northeast, and the Southeast. Each region has approximately 13 to 15 counties in it. And what we've done, we've placed regional program outreach coordinators, or RPOCs, within each one of those regions. The job of the RPOCs is to get out into the communities, find resources for veterans and their families that may not normally be well known through federal and state programs. They also collaborate with other state agencies, other federal agencies, and what the primary purpose of those RPOCs is to collaborate, make those relationships, assist people with, finding other resources that a veteran might need. For example, if a veteran is not entitled to VA benefits, they will go out and try to find community benefits that will assist that veteran. The other good thing is we started a resource and referral tool. It's kind of about 3-4 months into that, and we've already got about 1,500 resources inside that resource and referral tool. And recently it was announced through the Pennsylvania state government that there is going to be a enterprise-wide, statewide solution on resource and referral tools. So eventually the data and information that we're gathering today will be morphed into a program called RISE PA. RISE PA will be the overall arching resource and information platform that the state is going to use. But currently, like I said, we have about 1,500 resources in our database. And if an organization or a veteran would like some assistance on trying to find some resources, they could certainly reach out to our department and get a hold of either one of the regional program outreach coordinators, and they will do their best to assist them finding the resources that may be helpful or useful to the veteran and his families. Currently, our Region 2, the Southwest region, position is vacant, so we are going through the hiring process to try to fill that vacancy, and we get that person online and get them spooled up, and they will be participating in the same activities that our other 4 RPOCs are do on a day-to-day basis. So anybody have any questions about the department or what programs we offer here, please feel free to reach out and get a hold of us. We will do our best to assist you with the information. And also register on our website. We have a veterans registry. The Veterans Registry has about 40,000 people in it now. We'd like to get a lot more. The good thing about that registry is when a person registers, they don't have to be a veteran to register. When they register with the department, every Wednesday we send out a digital digest, which contains a lot of information in it about veteran services, benefits, employment opportunities, events going on. So it's a very good tool for resource information, and it seems to be very popular around the veterans. So please register with the department in that registry, and check our website out, all our programs. And like I said, if anybody has any questions, please contact us. Thank you.
Thank you very much, Chip. And I am part of that registry. I get those emails and they're wonderful. And thank you very much. Dwight Bodorf, he's the one who made this whole thing happen, corralled us all, brought us together, has been bringing us together for our 4th here virtual Veterans Town Hall. Dwight is the Chief Veterans Affairs Officer for Allegheny County. Thank you, Dwight.
Thanks, Todd. And just thank you to everyone for being on here. I know COVID has been difficult for everyone, organizations included. I'm very happy to say that the Southwestern Pennsylvania has worked really well together, from the federal government to the state government to county, city, and all of our nonprofit partners, Veterans Leadership Program, Veterans Place. Everybody has done a tremendous job. instituting new programs, modifying rules and regulations, and anything that we could do to help make sure that veterans are getting the services they need during this time. That being said, in the interest of time, I'm just going to, as usual, I try and keep it short so that there's more time at the end for questions or anybody else who needs extra time. But Ellie, if you could go to the next slide, please. So Allegheny County Veterans Affairs, for those of you who might be new to this kind of town hall format, every county in Pennsylvania has a veterans director. We are here to assist veterans with information about veterans programs at the federal, state, and local level, as well as actually helping them file for those benefits. We serve as an in-between between those agencies and the local veterans in the region to keep them updated on the progress of their benefits information and help solve any problems that might arise. We also work hand in hand with a lot of the nonprofits, the hospital systems, and anybody else that we need to make sure that veterans are getting services they need, such as assistance with possible homelessness, food insecurity, or just connecting to other veterans groups if they want to do things like go out and do helping rebuild houses in Pittsburgh, or kind of just even social activities. There's a lot of that in our region that we can help connect to. Additionally, we utilize quite a bit of these services that I'm not going to go too much into detail about, because I'll let Dr. Stahl and Aaron Melius from VLP talk about, as well as the state. And I did want to push too, that if you are a veteran or somebody or a family member, a family that is struggling, that the state does run the Veterans Temporary Assistance Program, which it's possible to get up to $1,600. It's not always guaranteed it's going to be the $1,600 or that you're going to be awarded, but it is a resource out there specifically for COVID. It has been beneficial. So if you are struggling with COVID-related expenses or things of that nature, please contact us, contact the state. We can assist with getting that. And then the other big thing at this kind of time that we're seeing too, as Elizabeth had mentioned, if you or any loved ones are aware of any kind of veterans pension poaching or other schemes that are affecting them, they're being charged money, for example, to file for benefits and things, please let us know. We do work with the VA and the state attorney general to make sure that veterans are being protected and that they're getting services appropriately and that their tax dollars pay for. And then the last slide is you can contact us. We are still open to the public. We stayed open during the pandemic. So if you do need to see us face to face, we just ask that you call and make an appointment. We are located at the Soldiers and Sailors Memorial Hall. You can certainly call us. We do recommend that you email us though, because of the call volume. But either way, we will get back to you and we'd be happy to assist you in any way that we can. And I'm going to leave it there, Todd.
Thank you, Dwight. Yeah, and I recently heard about your call volume at the Veterans Affairs Office in Allegheny County. I don't know how you handle it. Thank you very much, Dwight. Thank you very much for gathering this group together here. We're going to go to Chuck Keenan next. He's with the Bureau. He's also with Allegheny County. He's with the Bureau of Homeless Services. Chuck, are you with us?
Yep, I'm right here.
Hey, Chuck. Thank you for joining us.
Sure, thanks for having me. I appreciate the time to talk to you guys about what we're doing. So I work for the Allegheny County Department of Human Services in our Homeless Services Bureau. So I'm going to talk mostly about housing and homeless services that we offer at the county. So we offer a number of services, and it's regardless of discharge status to veterans. So it doesn't matter if you have a dishonorable discharge or an honorable discharge or any kind of discharge, you can still receive services from us. So we do permanent supportive housing, which is kind of non-time limited housing for people with disabilities who are homeless. We do rapid rehousing, which is about 2 years of services typically. So we try to do a year of housing and case management service. We operate the shelters in the county and fund a number of homeless prevention programs. And one is really new, and I want to talk most of my time about this program, which is called the Emergency Rental Assistance Program, ERAP. I'll put a link to the program I'll put a link to the program in the chat. right now. So this is a rental assistance program. It's for 12 to 15 months for people who are behind in their rent or utilities. They don't technically have to be behind yet, but they if they have an obligation for a future month that they cannot pay. So right now, if you paid your April rent, but you don't think you're going to be able to pay your May rent, you can apply for this program. There's 5 eligibility requirements to it. One is you have to be a resident of Allegheny County. So every county in the state has this program, but we have it through this website that I just posted in the chat. So you have to be a resident of Allegheny County, have to be at or below 80% of the area median income for your household size. So for a family of 4, it's like $65,000 is the threshold for that. You have to have a COVID-19 financial impact. Typically, that's a loss of income or unemployment, an increase in expenses due to COVID-19, or another financial hardship due to COVID-19. Those could be things like burial costs, increased medical expenses, increased childcare expenses. We know that there's been a lot of impact on families because of the pandemic that they weren't expecting. So kids are home from school, people have had to quit jobs or have had to take reductions in pay, had to bring family members in. Any of those kinds of things as an impact can make you eligible for this program. So it doesn't just have to be a loss of income or unemployment. There are other impacts that count. So if you have some sort of negative financial impact and it's causing you to be unable to pay your rent or utilities, you can qualify for this program. And then the last requirement basically is that you have a lease. That doesn't have to be a written lease. We take oral leases for the program. So, if you don't have a written lease, we basically just write up the terms of an oral lease, like, your address and the parties to the lease, the rent amount, when the rent's due, those kinds of things, and have that as a form. So it's pretty simple. We want to say yes to people in this program. Allegheny County received $80 million for this rental assistance program. So it's pretty substantial. We think we can help somewhere between 10 and 15,000 households in the county. To date, we've gotten over 4,600 applications. We just started taking applications March 15th. We'll continue to do that until the funding is exhausted. The program extends through September of 2022. And like I said, people can get up to 12 months of utility and rent assistance with the program. So again, you don't have to be a vet to access this, but it is open to veterans. We're trying to get the word out about it. And if you want to access any other program besides this COVID rent relief that's for someone in a housing crisis, you can call the Allegheny Link. That number is 866-730-2368. And I can put that number in the chat as well. So I think that's really the highlights that I want to talk about.
Thank you very much, Chuck. I appreciate it. Thank you for joining us. And from Allegheny County, we're going to go to the City of Pittsburgh. Laura Dragowski, thank you for joining us again. Laura, you are with the Office of Community Health and Safety Manager.
That's right. Thank you all so very much. And great. You've got my slides up for me. I'm always a little bit more cumbersome when I have to do it myself. So as always, Todd and team, Ellie, you guys are so wonderful. I want to thank you, Dwight, for helping us all to get this information out and always putting the veterans first in our community, and also to all the providers and partners who are doing the work. We know that veterans help, and we know that it's really important to help the helpers. So some of this information, if you've joined before, is not new, but we update these pages with great frequency, and we want to make sure that you continue to have access to that updated information. So the city's COVID-related updates are going to be available at the link at the top of this slide. You can always call 311 from inside the city for any non-emergency requests or concerns, and they will help you as much as they can. They're some of the greatest staff in the city, really always trying to do well for our residents. The bigberg.com website allows you to navigate and find free low barrier resources. They have a whole host of veteran specific and veteran accommodating resources, but they have resources for anybody who would need something that is free and low barrier. Our URA, Urban Redevelopment Authority, has some really great programs that I'm going to dive into a bit in a few slides. And I've included my email address and cell phone number I do truly mean you can call or text me. I will get back to you, or I will make sure that someone inside the city does as well. And if you are outside the city and you happen to contact us, we're very fortunate to have good partners like Chuck and Dwight and VLP and Veterans Place and the VA, so we can always help to redirect you to the person who can do the most for you. Next slide, please, Ellie. So we know that this has been a deeply, deeply burdensome financial time for many people. Just referring back to our URA resources, Small Emergency Loan Fund, we have the Get Online, Grow Online program. It's to help move businesses to online commerce, and it includes businesses in Wilkinsburg, Sharpsburg, Millvale, Etna, McKees Rocks, Mount Oliver, and the city of Pittsburgh. And of course, that's something that you can access from the URA site. We also have something called the Pittsburgh Financial Empowerment Centers. There's wonderful resources for financial empowerment across the region. This is just one of many, but it's a really great one. It's totally free. It's fully agency promoting. So whatever you decide you want to do, they will help you to do it. Some things that they're often asked to help with are reduction of debt, increase in savings, assisting with improving credit scores, and accessing those safe, non-predatory banking products, which we know that there's been a lot of emphasis on that in this call. Next slide, Ellie, thanks. Something that's come up this year, and I'm not including a lot of information because I think it could take a pretty long time to present, but inside of the city of Pittsburgh, the city council passed the Paid Sick Leave Act. That's really intended to make sure that people who are sick and maybe haven't historically had sick days have those days so that they can retain their jobs. We know this is a deeply difficult thing for people who have kids and transportation challenges, and it's just it's impossible to not get sick. We've found that out through this entire year. So more information is available at the website that's listed there. You can also email directly to paidsickleave@pittsburghpa.gov for more information. Next slide. This one's got a lot of, I don't know, I think maybe from a design perspective, this is suboptimal, but I wanted to make sure that we acknowledge all of the incredible partners who are doing this work. So the first thing we list is a program that was born out of the Emergency Solutions Grant HUD funds. This is to just augment the already really excellent homeless services programs that are in this county. And as Chuck was discussing as well, we want to highlight this one in particular because they also have some legal resources and some healthcare navigation resources. They're really responsive. They're excellent. I talk with their teams on a daily basis. So they're not just working with individuals who are homeless, though that is primarily who they assist. They're also working with people who may be in a really precarious state. And again, if that person wants to speak to Veterans Place or Veterans Leadership Program or Bethlehem Haven or Community Human Services or all these marvelous partners we have across the county, they will help you with that too. They also are working with our law enforcement, so our Pittsburgh Bureau of Police and Pittsburgh EMS, to start to move toward co-response and alternative response for calls that might involve a mental health issue. Our officers are extremely excited about it. It's something that's been discussed pretty widely in our country in the last year, and I think that we have a ton of buy-in from all of our partners on this, so it's great, and we've had some really great opportunities, or the teams have, from Allegheny Health Network. So again, the phone number is there, and you can reach out to Nicole. She's their health systems liaison and doing a lot of this coordination. And if that's not the right place, she will help you to get there. Also, just wanted to point to you for some references to the eviction moratorium. There is a CDC eviction moratorium that's been extended. The city also has an eviction moratorium. We know that it is difficult for tenants and for landlords, right? Most of the landlords in this county are not big landlords. They have a few units. So it's really important. I just want to reiterate what Chuck is saying about the rental assistance program, the ERAP. That's an awesome program that the county has driven forward, and we've had tremendous leadership from Action Housing, Dollar Energy. And so I just want to reinforce what Chuck said, that's not just for tenants, really. That also helps to make sure that landlords are getting those payments and that they can sustain their properties as well, because we know it goes both ways. If you wouldn't mind going to the next slide. I wonder if I gave you paid sick leave twice. I did, so we can just skip that one. So nice we have it twice. This is a new website that gives you better access to resources for the city residents for young people. So separated by 0 to 5, 6 to 13, and 14 to 24 years old. And there's some amazing programs there, youth employment, and other resources for kids throughout that time, you know, as a little baby to I guess 24 is pretty much an adult. So these are also resources for parents or grandparents or caregivers if you'd like to learn more. Next slide, please. This slide probably looks familiar, but it bears repeating. We do have the Dolly Parton Imagination Library in the city of Pittsburgh. It's really a fun program. Grandparents, parents can do this for their kiddos. It's up to the age of 5. You do have to live in the city again for this program. And I know that it's sometimes really frustrating because you might have a Pittsburgh address, but you're not a Pittsburgh city resident. So that is something I just want to let you know that it is for city residents only, but very important. You get a free book, an age appropriate book sent monthly to you to share with your child. Here's some great learning resources that are also listed and childcare information. And I know that everybody's really tight on time. So if we just want to jump through these last 3 slides, I can speed read. Just letting you know, there's an email here, Tiffany Klein-Costa at pittsburghpa.gov. If your organization or you have constituents who need masks, we still want to make sure we get those out. We know that there is an ongoing need for that. Next slide, Allie. Food security, there's some great resources here, and I know that this presentation will be shared. So just reminding you that, you know, there's no shame in being food insecure, right? We want you to be healthy and well and safe, and we want to make sure that you've got that food, and we know it's been a difficult time. And the last 2 slides I will certainly speed through, just letting you know that we have some partners who have been operating really in high gear during the pandemic. We've seen a lot of really tragic overdose-related harms and fatalities. There is an organization called Prevention Point. They do distribute supplies for people to use drugs, and maybe equally or more importantly, they also help people to get access to treatment and other resources. They also are doing mobile-based buprenorphine, which is Suboxone. It's an evidence-based medication for opioid use disorder. So these are their sites that are staffed by really brilliant and wonderful people who will keep everything confidential. And the next page is the last one, which also gives you some information. If you or someone you know is struggling with drug use, you can make that call to neverusealone.com and they will check in with you. You can get Narcan from the health department, and we just encourage you to continue to be as safe as possible. Todd, I think I'm done, but thank you.
Thank you, Laura. Laura, she is our 7th and just eloquent speaker that we've had today. And I think you do win the award for cramming the most words in your 10 minutes. So thank you for that. We are off to my friend Ben Stahl, Dr. Ben Stahl with the Veterans Leadership Program. He's the executive director. Good afternoon, Doctor.
Good afternoon, Doctor. It's a pleasure to be here today with everyone. Thank you for all the information. It's definitely helpful to know that all these community resources are out here. I do not have a lot of slides. I'm a proponent of extemporaneous speech. So I think I know enough about our programs and services at VLP to jump right into it. And in the interest of time, I will do just that. So a little bit about Veterans Leadership Program, if you're not familiar. We were founded in 1982 as the Vietnam Veterans Leadership Program, and through the course of the last 37 plus years, Veterans Leadership Program has continued to evolve, much like the veterans in our area, and we have continued to meet the needs of the contemporary veteran. We do that by working our mission of empowering veterans to navigate the transitions of life. And we work our mission by providing veterans with housing, career development, wellness, and supportive service opportunities in the Pittsburgh, Butler, Erie, and Altoona VA Medical Center catchment areas. So if you're a veteran living in essentially the western part of Pennsylvania, in some counties stretching into New York and Ohio, you can see on the slide, those are the counties we provide services in. And if you don't live in one of those counties, we'll do our best to get you the services that you need. So a little bit about, some of each of our program categories. Housing. In 2020, we provided housing services to 750 veterans and their family members. We operate an extensive portfolio of community resources for those experiencing housing instability. As Chuck mentioned earlier, the Department of Human Services has rapid rehousing programs and permanent supportive housing programs, both of which VLP operates through contracts with Allegheny County and the Department of Human Services and the Department of Housing and Urban Development. We operate the Veterans Administrators Supportive Services for Veterans Families, which provides homeless prevention and rapid rehousing services to veterans in all of those counties that you see listed on the placeholder. And that is, if you're in rental arrears, if you're facing eviction, if you're, otherwise housing insecure, and you're eligible for VA services, we are able to provide you with that assistance. We also operate a bridge housing program in partnership with the VA in each of those respective VA medical center footprints. So we have a program in Erie, a 10-unit program in Altoona, 25 in Pittsburgh, and 10 in Butler. You can't keep a house without revenue, income to make ends meet. So with that, we move on to career development. In 2020, we provided 572 veterans with the assistance they needed to get a career. And we do that primarily through resume preparation, mock interviews. We have a program to get male and female veterans business attire, suits. It looks like a Joseph A. Banks down in the Strip District right now with the amount of suits that we've been getting over the course of the past couple months. So if you're a veteran who is unemployed or underemployed, VLP has a resource to assist you to get to the next level of where you want to be. A little bit about our supportive services. We provide in 2020, 1,818 veterans with supportive services, and this ranges from one-time financial assistance. You're behind on a utility bill and you need some assistance to get that cleared up. We have a free store on site that has a variety of consumables, general household consumables, cleaning products. We're a Greater Pittsburgh Community Food Bank food pantry site. So we have consistently have food on hand. In 2020, we began doing drive-up food distributions, and we served over 2,000 individuals with a share of food in 2020. We're continuing that as we get farther into 2021. That's definitely been a big need that we saw manifest itself. We also, provide transportation assistance. We have two dedicated staff members who they're SOAR agents, so they assist veterans who are applying for Social Security disability insurance or SSI, process those applications and serve as a liaison with your medical providers to get you the best optimal outcome at your first time at bat with Social Security. If you've done that yourself, that could be a daunting task, and our staff has a very good turnaround time and a good batting average in getting people their claims processed through at the first time. The other important tier of our programs is wellness. And the intent of our wellness program is to complement the services that we provide in our other program areas, so our housing, career development, supportive services. And the wellness program follows the 8 realms of wellness, whereas our housing, career development, supportive services would be the financial, occupational, and environmental realms of the realms of wellness. The social, intellectual, emotional, spiritual, and physical needs get met in our wellness program. So we offer stress management, nutritional guidance, meal planning, health coaching, physical fitness opportunities to socialize with veterans, a full complement of services to help close that loop in terms of holistic health. And we also provide healthcare navigation. So if you need help, assistance, navigating the complexities of the healthcare system, that's something that we can assist you with as well. And I know we were hoping to get to Aaron for PA Serves, and I didn't know if that was a piggyback, but One of our another service that we provide is the PA Serve service at VLP, and that I'll let Aaron get a little bit farther into that, but I appreciate everyone's attention.
Thank you, Ben.
Thank you
very
Dr.
much. And thank you for also, Aaron, for you joining us today. Good to see you. It's been a while since I've seen you in person, and I'm glad you're joining us. Looks like you're outside enjoying the nice weather, at least.
Yes, for sure. It's nice to see you again, Todd. And I'm here to talk a little bit, piggyback on that, and talk about PA Serves. I guess the first thing to say is we've literally just gone through an hour of community resources that didn't even scratch the surface on all the different programs that are out there for veterans and their family members. And I'm overwhelmed. You know what I mean? And I do this for a living, navigating resources. There's so many things out there. And this is a good segue into sort of why we exist at PA Serves. We are here to help you navigate that service journey with the veterans and their family members. Like I said, we just went through an hour's worth of resources. Our job is to help you navigate those services. What we are so far is we've been around for 5 years. Recently in December, we transitioned from Pittsburgh Mercy to Veterans Leadership Program. We are housed at Veterans Leadership Program, but our operations and the way that we've gone about serving veterans hasn't changed one bit. So while we're housed there at Veterans Leadership Program, our operations haven't the same. We're here to still build a community-based referral network to get veterans to the right services at the right time. In the 5 years that we've existed, we've connected 6,000 plus military connected clients to more than 18,500 requests. During COVID, we've connected over 1,000 veterans to about 6,000 resources. So in our 5-year period during COVID, we've been very, very busy connecting veterans to services. Those services mainly include food insecurity, financial assistance, employment, and transportation. So we're out there making connections with programs who do that kind of work to help veterans get connected. So what are we at PA Serves? We are essentially, in layman's terms, a relationship building, problem solving team that uses a tech platform that really improves the referral making process. Our job is to get veterans to the right place, to the right resource the first time. Sort of what we're not. We are not a coordination center that's going to give a veteran a list of numbers and wish them luck on their service navigation journey and hoping they find the right resource. We are very targeted into who we send resources or who we send the referrals to. We don't want the veteran to have to hear no again. By the time we send a veteran to a resource, where we are pretty certain that that veteran is going to be accepted in that resource and receive those services. We are not a Yellow Pages or an Excel spreadsheet. We are human beings sending other human beings to community partners to get resources. And we take pride in the fact that at 98 or 99% of the time, which is our data shows, is that we're getting a veteran to the right place the first time. That's very, very important to us during this time. The tech platform is sort of how we do our job. It helps provides transparency and accountability. No more referrals getting lost on the fax machine or in emails. You open up the tech platform, you can see which programs are doing what they say they do and that we're doing what we say we do. Our job is to get those veterans to those programs. We have 75 different in-network providers and 25 plus growing out-of-network providers that we use on a weekly basis. Those programs range from, federal government programs that you've heard about today, all the way to very small mom and pop nonprofits that are here to help support veterans. And during COVID, while a lot of the veterans were getting their needs met here locally, we've also now incorporated a lot of national-based veteran service organizations that can help us meet the needs of local veterans here. So we're also trying to bring other resources here to veterans in the area. That's really been part of my big focus here in the last year is having these national resources, use their funds to help veterans here in Western Pennsylvania. You can go to the next slide. This is essentially just a visual representation of sort of what it looks like for a veteran that comes into PA Serves. We get referrals from other in-network providers that send their veterans to PA Serves. And then we essentially are wrapping a care a care team around those veterans. We're addressing the short-term need and then also looking at working with the veteran to find out what their long-term goals are. So we're not just getting a veteran in during a crisis situation and trying to put Band-Aids on those situations. We're also looking forward-looking, making sure that we know what their goals are long-term, and then we're connecting those veterans to programs, whether it be employment or education or benefits. So we're not just focusing on the short-term needs of the veterans. We're looking long-term as well and getting veterans into a care team that help them complete their long-term goals. Next slide. Like I said, during COVID, nothing's really changed for us. We are a tech platform and do most of our work over the phone. So like I said, nothing's really changed to get a hold of us. There is our coordination center number. That number is staying the same with our transition from Pittsburgh Mercy to VLP. You can easily reach us at our website there and put in an assistance request. And then if you are a veteran and you are working with other organizations who serve veterans, chances are those 70+ providers will have the ability to make a referral directly to us on your behalf. So there's no real wrong port of entry to get into serves. You can call us, you can go to our website, or you can ask another veteran service organization with assistance to getting in connection to us. And like I said, thank you for having me, but that's all we have here for PA Serves today.
Thank you, Aaron. And as the director of one of those mom and pop nonprofits, I'm very grateful for the veterans that you send our way who want to connect with the veterans community. And then it also works the other way, where we have veterans who need a referral. And I always know if I pass them on to you, they'll find the answers they need. So thank you very much, Aaron. And I'm looking at the clock here. We have some time for questions and answers. And I know a couple people have submitted questions ahead of time. Ellie, I know there's one I might just put in the chat here verbatim. Maybe we could start with that one. And it is this: considering that the distance to the Aspinwall campus in-house VA adult care daycare facility may offer long travel times for certain local veterans or their family members, and with COVID-19 pandemic may have been operating at a limited capacity or not at all, can the panel please advise why the Pittsburgh area VA office declines to take part in the VA community care network relative to adult daycare services, as opposed to other Pennsylvania VA offices that do take part and provide funding for eligible veterans and or their spouses?
Wow, that's a great question. So we definitely do participate in the community care program specific to adult day healthcare. Ms. Ford, unless you have any information, I think I'll have to investigate that and get the answer back to Todd and Dwight to share.
Okay. Okay, thank you, Shelley.
Oh, Ms. Ford, you're on mute if you're speaking.
Yeah, Lavetta, if you want to unmute yourself.
Yeah, hi. So the question specifically was about adult day health care and providing services in the community.
Correct. Yeah.
Yeah, we do that. I don't know if you maybe want to email Shelley more specific information, but that's a service that the VA Pittsburgh provides. Am I muted?
No. We hear you. We hear you. Okay, Bill D. Sabato, here you go. You want to add to the question and thereby give yourself away as the asker of that question.
Yes.
Hello, Bill.
First, I want to thank you for the town hall meeting. This is a great meeting, great information, and all the panelists gave some very relative important information. Yes, I submitted the question. Actually, it was changed a little bit. So Ellie, you read the first one. I updated it a little bit, but nonetheless, that's the gist of it. I work at the Sarah Care Adult Day Center in Forest Hills. My wife started the business 19 years ago. In September, I'll keep this as brief as I can. In September of last year, we were awarded a contract through the VA to join the community care network locally here to provide adult day services to veterans. I'm a Navy veteran myself. What we've run into, though, in other words, that would be funded through the VA, through United Healthcare, administered by Optum. Unfortunately, what we've run into is that the Pittsburgh area VA office has declined to take part in the community care network. Now, we know that other offices in Pennsylvania do provide funding for eligible veterans for adult day services. So our question is, in terms of, can anyone answer why the local office has declined to take part in the community care network? That's the gist of the question. We'd like to have an answer on that if we could. We're very excited about being awarded this contract. We'd love to be able to offer this to local veterans who may have too far to travel to the Pittsburgh office. I'm not sure if that's the Pittsburgh adult daycare through the VA is even operating at this time due to COVID. But we are open, we are operating, we're providing adult day services. We have had veterans attend our adult day service over the years, but they cannot get funding through the VA. They normally will attend on a private pay basis. So now that we have the contract to work with the VA through the community care network, we're hoping that we can get an answer, or at least maybe the VA locally will change its policy to be able to provide funding for eligible veterans and or their spouses. So if anyone can answer that question now.
So, no, we're going to have to look into that because, so I will answer one of the questions that you asked. We are not currently operating adult day healthcare, but we do absolutely participate in the community care network. So this is a question specific to adult day healthcare. So I'll have to look into that. Todd or Ellie, would you be able to send me Bill's email address or phone number?
You bet. You bet. We'll
Thank
put
you
you
so
in
much.
contact.
We'll get back to you, Bill.
Thank you, Shelley. Appreciate it. Thank you. Thanks,
Thank
Todd.
you, Shelley. Thank you, Bill. And Ellie, we have another question that was submitted ahead of time, I believe.
I think we had an announcement about Irreverent Warriors.
Is somebody from Irreverent Warriors with us?
Oh, they might have hopped off actually early.
Okay. And Irreverent Warriors is, I can't even begin to guess.
An organization that has a veterans hike coming up on May 29th, and we can post to our social media and invite them to post about that event coming up.
Okay. Okay. Very good. Maybe we could get in touch with them and help spread word. And I do want to let people know we have a Reverent Warrior, Larry Guggens, who's the PA president of Vietnam Veterans of America. And we also have, we also have Marcy Callan, who is the Veterans Liaison and Community Relations Liaison for Congressman Connor Lamb's office, just in case they have something to announce. Larry, you can unmute yourself, Larry.
Unmute. There I am. Todd, thanks again for sponsoring these programs. They're excellent. I just wanted to pass a couple of kudos on the Veterans Leadership Program. I work with them and have been in Beaver County, and of course they have multiple counties, as you well know, and so that really helps us out. And of course, also PA Serves, Aaron. I think you're familiar with that. But I just wanted to pass on at least 3 names, but everybody in the Veterans Leadership Program does a great job. But we've been working more directly with Randy Levander, and of course Christine Miles with the Veterans Treatment Court and others, and let me see, and Nick Fate. I think Nick is still there, and I hope he's doing well, Mr. Stahl. I know he had a tough time last year, and I think you know what I'm talking about. I hope Nick is doing well, but they are excellent. I mean, they are, and I'm sure the whole I've been to a couple of Veterans Leadership programs, and they're excellent. So, Mr. Stahl, I just want to thank you. From Beaver County, we're the lone folks out there that everybody forgets about, and I don't mean that sarcastically. I understand why. Most of the services are from Pittsburgh, but it's PA Serve. Just a question: is PA Serve now under the umbrella of VLP? Is that the way I understand it? So we could contact Aaron. We could contact you or contact VLP for the services that PA Serves provides. Is that correct?
Yes, it's maybe a different front door, but it's the same waiting room.
Excellent. Thank you very much, Mr. Stahl. But again, mostly I just want to say thank you for reaching outside of Allegheny County. And again, I do not mean that sarcastically. I mean it complimentary. So, but
Thank
Todd,
you very much.
Thank you very much for everyone on here. I'm a little disappointed we don't have more veterans. I don't understand that. Never have. You and I never do. But they should attend these to find out where the services are rather than call you, me, and everybody else and saying, where do I go? But anyway, thanks for everybody. And I hope you keep doing it. Some of us will learn, at least I know where to, again, emphasize where to send people.
Well, and Larry, also, because this is being streamed on our Facebook page and YouTube, it'll live there for a while. It'll live there for a long time.
Yeah.
So I expect people will be watching, not live, but watching the recorded version, maybe getting their information that way.
I'll remember to pass that on.
Okay.
And put it on our website and email addresses also. I sometimes forget to do that. But and I'll see you next week. I thought you were on vacation this week.
This is my vacation.
Okay, yeah, mine too.
Yeah, this is great. This is my vacation.
Probably everyone here is on vacation today. Yeah, I can understand that. Yeah, and most of us aren't getting paid either. So anyway, but again, thanks everyone for doing it. I hope you had a great Easter weekend, great holiday, enjoying the weather while we have it, and I'll keep in touch with you, Todd. I have one note I got to send you, a personal note. Yeah, it's
okay.
But the things happen. So not about me, about someone we know. But thank you very much, everybody.
Very good.
Appreciate it.
Marcy, Callan.
Hi, everyone. Thank you for having me. Another wonderful event, Todd. Thanks, Dwight, for coordinating. I do love these. It's hard to keep in your own head all of the resources available for veterans. So for me, this is great just to be reminded of all of the great things that everybody is out there doing. I do have an update, and it's a good one. I think a lot of you are well aware of the backlog that the National Archives was experiencing, and it was very difficult to get our hands on veterans records, DD-214s. I had the great honor of participating in a one-on-one call with the White House a couple of weeks ago to let them know they're a new administration, to let them know what the backlog was. We saw within days movement on that issue, and I'm happy to report that the Congressman Lamb has worked with the administration. They are going to get every single employee at the archives vaccinated. In fact, I think that may have already happened, that they've gotten their first round, which will allow them to increase their capacity from 10% all the way back up to full percentage, get their people back working. They're going to work in shifts. They're going to work weekends. Before that, they were looking at a, believe it or not, 2 to 3 year long backlog because of all of their requests. They're going to be able to winnow that down significantly. Obviously, there's still lengthy delays, but we are thrilled that we're going to start seeing here pretty soon that turnaround in records go a little bit faster. Thank goodness.
Thank you for that update. Oh boy, that is good news, Marcy, because Dwight and I were just talking about that backlog at the National Archives and Record Administration, and it's something that veterans have been struggling with the past year. So thank you for that update. That is good news. That's wonderful. Dwight, do we have any other questions or comments here from those who are on the call on the Zoom side?
Not that I got anything, Todd. I mean, there's always questions. And of course, we just encourage you to reach out to anybody on this panel. We all work with and connect with each other. So if you do have questions, if one of us can't answer it, we will certainly send it to one of our colleagues who can get something out as a response.
What is the plan for all the PowerPoints that were shared today? We could make them PDFs and share them with everybody, maybe make them available. What is our process for that? You'd think I'd know, but maybe.
We've done in the past is we send them out to people who are registered.
Okay.
So as like on Eventbrite, we can just put them in PDF and kick everything out.
Got it. Yeah, that slipped my mind. You get old and you start forgetting how things work. But yeah, that's what we've done in the past.
Well, in all fairness, it's been quite some time since we had the last one, a couple of months, and everything with COVID in the last year has just flown by, and there's a lot to digest.
Yes, that's right. All right. So this is our fourth and maybe final Veterans Virtual Town Hall for COVID-19, that is. And
Yes.
we'll have more town halls, but this might be the final COVID-19 one, although for some reason, I just think we'll probably have another. For the good of the order, and unless anybody has anything else to add, we could close it up and let everybody know that we will be sending out those PDFs that were presented today to everybody who registered for the event. All right.
Thank you so much.
Good afternoon, everybody. Enjoy the rest of your day. Thank you for joining us.